Medex Physiotherapy. Today we are discussing on the topic of cervical traction. The most of the people they have a doubt either we have to take a traction or not. For that clarification, I am here today to explain what is traction, when to take, and when to avoid, and what are the precautions when you must take before taking a traction, and what are the benefits. So first most important thing when it comes to traction, the traction is used not today, it is 1000 years back it started the traction. Initially they started when it comes to that before Christa. That's a before Christa we can tell as the Hippocrates, the 360 BC. He used the traction to align the vertebral columns. So first most important thing, how he aligned the bones. He used the wooden table. The wooden table he used for to align the spine, wooden spine. So this wooden table he used to use for the align the spine. He used two people to drag the spine by using a rope and the pulleys. And he is applying the pressure on the spine to reduce the dislocation or to correct the spinal alignment. This all purpose he is using that traction in the olden days. After that, there are so many methods it comes. It's through skin traction, applying a bandage and putting a rope, and applying the sandbag. The sandbag method also is for the second method. Now advanced we are using a cervical traction machine and the bed, all this equipment to give a very good result. Earlier days they were not having much technology to give an effective treatment. Nowadays we have all the technology, advanced equipments to give relief the patient's problems or to reduce the pain. Now what are the things it's composed? The one thing we use this is called as the traction machine. We use for both cervical and the lumbar, and this is a traction bed, and we have using the pillow to give a traction, and we have a horizontal bar. This bar we used to use for the traction holder, and this is we use for the head halter to hold the head within this, and we are giving a effective traction with that. Now I am demonstrating how to give a traction. Please come. So now there are two methods to give a traction. One is we divide the neck. This is the upper neck traction and the lower neck traction. Then what is the importance of upper neck and the lower neck traction? So upper neck traction means from C1, C2 and C3, these portions. That is helpful for cervicogenic headache or any problem with the upper neck. Or those problems we are using a upper cervical traction. Upper cervical traction usually we give in the, just move down. It's in the chin down position. This is the position we are giving a upper cervical traction. We apply the head halter and make the patient to chin down and putting a rod. And we are switch on the machine, and this is having a major components. One is the time setting. We set the time, how many minutes we have to give. Usually we give 8 to 12 minutes or 12 to 15 minutes for the traction. And again there is a weight. The weight is usually 8 to 10 kgs. It depends upon the age also and the body building. Then when it comes to that, there is a hold time and the rest time. Now you can observe the traction is pulling, and you can see the rope is moving inside the machine, and it gives a decompress the spine, the upper neck. So this is the one what we give a method to correct the traction. See how we can give the traction. So this, what are the advantage of this? One is it decompress the spine, it is align the spine, and it reduces the neck pain, and it improves the blood circulation, and it is lengthens the muscle and means the muscle length. It will come back to the normal length. These are the benefits of the upper cervical traction. When it comes to the lower cervical traction, we have to shift the patient. Just The neck should be in the little bit, just move to the back side. So now the traction we are applying for lower cervical, that is C4, C5, C6, C7 level. So again we have to lock the machine, we have to switch on the machine. So we can see that we have set the time, then again we are starting the traction. This traction which is helpful for brachialgia or any radicular pain, C4, C5, C6 related. So it is related to the if some people having a radiating pain to the elbow, wrist or arm, those patients they get benefit through this type of traction, that is a lower cervical traction. This is one. These are the advantages. So some people they say don't take traction, but you have to decide when to take and when we are this traction is contraindicated. The indication of traction basically if any cervicogenic headache, if any problem with the neck. If degenerative spine is like cervical spondylosis, if it is some vertigo in related to spine, in some certain cases of disc bulge, and even some people having a thoracic outlet syndrome, these all syndromes we can use the traction. When to not we have to avoid this traction. So in some conditions like we can avoid the traction in certain conditions like acute injuries, acute whiplash injuries, acute any bony dislocation, any fracture. So those conditions should avoid the cervical distraction. This is one of the things you have to know that. But some of the doctors they misguide. Some doctors misguide, don't take traction. That's actually wrong. We have to give a traction to get relief, the maximum relief we are getting to patients to outcome from the cervical radiculopathy or disc bulge, and even some cases with the cervicogenic headache. This is one of the most effective treatment. You can all go for it, even to correct the posture, upper cervical posture to correct, because most of the people work with the computer or the mobile, they lost their curvature. So we have to correct all this through using this traction. This is very advanced and most useful techniques to reduce the neck pain. And I am just how to remove the traction. I am just going through that. We have to turn off after a certain time. The machine will turn off. Then we have to unlock the machine. So we have to release the cable, and we have to remove the bar and remove the head halter. Then ask the patient to rotate both the side neck from 3 to 4 times, and ask the patient to get up. So through all this method we can traction using the cervical traction, we can give a very good results. And please watch our video and share our videos, and please subscribe. Thank you.